Hello, my name is Araceli Martinez Betanzos, and I will be talking about the 3 types of stress for my informative speech. Have you ever dealt with stress, or is it something that you tend to push and ignore because you just have too much to do? Would it make you think twice if I told you that if you ignore stress for too long, you have twice the risk of a heart attack than others? I'll be talking about the 3 types of stress, what can cause them, and how you can treat them. Knowing what you can do to treat and stay aware of stress can help your body mentally and physically. The first stress that I will be talking about is the acute stress. The acute stress is the most frequent and common presentation that there is, usually caused by reactive thinking, and it is usually negative thoughts about situations like arguments or work deadlines. Some effects are some transient emotional distress, which is anger, depression, anxiety, and there's also the transient muscular distress, which is tensions, back pain, neck pain, jaw pain, and there's also transient hyperarousal, that is elevated blood pressure, that is rapid heartbeat and pulse, that is sleep problems, chest pain, dizziness, and migraines. Treatment is medication from your doctor would be the best one that I would suggest. This leads us to our next stress, which is the episodic acute stress. People who frequently experience acute stress and have triggers of stress usually have episodic acute stress. These people have just too much going on in their lives. They aren't organized because they just have too much to do and live a life of chaos and crisis. There's 2 main personalities. There is type A personality and there is warrior. Type A personality has a competitive drive and aggressiveness and is abrupt and tense and usually has a sense of time urgency, while the warrior has almost unending negative thoughts causing episodic acute stress. So they negatively forecast catastrophes in every situation that they're in almost every situation that they're in, and they have core beliefs that the world is dangerous and unrewarding. Some effects about the episodic acute stress is the emotion stress, like anger, short-tempered, they are impatient and tense, and as well as cognitive distress, like they compromise attention, they compromise speed and new learning, and also have mental fatigue. A treatment for this episodic acute stress would be a psychology treatment. Most of these people make it such a habit to be stressed out that they don't know that they're stressed out, or that they forget that they're stressed out. Unless they have physical pain or discomfort, when it just becomes too much, that's when they seek for help. Lastly, we have chronic stress. Chronic stress is the most harmful, and if left untreated, it can really damage your physical and mental health. Chronic stress can be created of a variety of reasons. It can be long-term poverty, unemployment, unhappy marriage, dysfunctional family, poor work environment, and just many more. The effects are symptoms previously mentioned with the acute stress and the episodic acute stress. But they can result in physical and mental breakdowns that can lead to suicide, violent actions, homicide, heart attacks, and strokes. Some treatments for chronic stress require extended medical and psychological treatments that include behavioral and stress management. Today I shared the 3 types of stress: the episodic acute stress, and the chronic stress. I hope this information opened your eyes in how dangerous stress can be, and if you push it away, ignore it. I hope you can use this information whenever you feel stressed out, whenever you feel like you're having the effects of a certain stress that can be harmful for you and your mental health and physical health. Thank you for watching my informative speech.